Hello again, everyone. Thank you so much for taking the time to join us today. Hopefully my audio is coming through all right, but if not, feel free to anyone to interject and let me know, and we will do our technical adjustments on the side as we go. So uh, welcome to the second session of the 2024 Child Right Virtual
Right.
Symposium. Sorry. My name is Pierre Zwigers, and I'm the Training and Capacity Building Coordinator for the network. This year's symposium is designed to bring together our diverse community of researchers, partners with lived experience, and advocates to discuss key issues and share our collective expertise. It's a pleasure to have you all here as we continue with today's session titled Knowledge Mobilization and Engagement, where the session will explore engaging partners with lived experience to enhance patient-oriented approaches to child health research and strengthening knowledge mobilization efforts in childbirth. Now, before we dive into today's panel discussion, it's my pleasure to introduce today's speaker, Dr. David Phipps, and session moderator, Jenny Gilbert. David is a leading expert in knowledge mobilization and has played a pivotal role in bridging the gap between research and practice. He currently serves as the Assistant Vice President of Research Strategy and Impact at York University. Jenny is Childbright's Director of Engagement, bringing over 20 years of experience in research, knowledge mobilization, and elevating the voices of those with lived experience. As a parent of children with brain-based disabilities, Jenny combines personal and professional expertise to lead our various engagement efforts. Following David's remarks, we'll move into a discussion with panelists representing three of Childbright's Phase 2 projects. From the Parent Voices project, we have Catherine and Fabiana joining us. From the JUA project, Ibrahim and Jillian. And lastly, the ADAPT project with Angie and Brenda. Later on in the session, we'll do some proper introductions of the panelists, and you'll get a chance to learn more about them and the work that they do in the various efforts that they undertake. So without further ado, let me hand it over to David, and we will get right into it.
Great. Thank you, Pierre. I'll just share my screen. Thank you very much for this invitation. And I'm just going to check in, Pierre. Can you hear me and see my slides? The slides are loading. It should be up now.
We are good to go.
Great. Thank you so much. Thank you for this invitation. I'll start out by saying that my name is David and my pronouns are he and him. I was born to white parents in England, and we immigrated to these lands that some people call Canada when I was 2 years old. I live with my husband in Toronto, and that's on the traditional territories of the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the current treaty holders of Mississaugas of the Credit. I am, as Pierre said, the Assistant Vice President for Research Strategy and Impact at York University, and the Network Director for Research Impact Canada, a network of 36 research organizations building institutional capacity for knowledge mobilization. I'm going to start out by getting us all onto one page about what mobilization is, what impact is, why we do this, and a little bit of theory, not too much on the theory. And then I'm going to talk about some of the experiences that I have had around engagement with people with lived and living experiences. So, and then that hopefully will set up for the panel. So just to get us on the same page, this is it from my colleague, Julie Bailey, who was at the University of Lincoln. She's now moved to Northeast London University. And she recognizes that research is generally conducted within academia. We know there's lots of great community-based research as well, but generally the research that we're thinking of happens in academia. And knowledge mobilization or translation gets it out of academia, and the effects, the impacts are felt in society, on the environment, on health, or on the economy. And that's the impact. That's what we want to have happen. Knowledge mobilization or translation is how we want to get there. But also I've added this line to Julie's diagram, the community engagement, the air quotes community. And we're engaging with, could be industry, it could be government, policymakers, could be community organizations, could be people with lived and living experiences. And that's another way that we listen to the needs that are in society, so we can do research that is engaged with societal actors. And Julie defines impact of research as the provable effects, hopefully beneficial, of research in the real world. Now, just as a sidebar, a colleague, Stefan de Jong in Netherlands, he asked ChatGPT to define what are the societal impacts of research. And ChatGPT came back with 4 paragraphs. They weren't bad 4 paragraphs, they were okay, but ChatGPT was effective. Julie is elegant with only 9 words defining impact. And to illustrate this, I'll use an example from York University where in our Faculty of Education, Stephen Gates is the professor that leads the Canadian Observatory on Homelessness. And that he's got research funding from the Networks of Centers of Excellence, from short partnership grants, and he works with the PWLE, People with Lived Experience Network. He calls LiveX. So people with lived experience of homelessness, either living in homelessness situations right now. Often it's graduate students and faculty members who have had lived experience of youth homelessness. Works deeply with them in research. The Homeless Hub is his mechanism for knowledge mobilization. It hosts a number of not just research articles or not just academic articles, but clear language summaries, infographics, videos to make research accessible. Away Home Canada is a national nonprofit working in housing first for youth across Canada. And so that's the community organization where he's working with Away Home Canada, listening to the needs. And you can see on the top right, the impact that has been made. This was from a couple of years ago, but the couple of thousand youth that have benefited from improved housing, returned or remained in school, become employed, or improved positive family connections. And so again, the research has happened with, engaged with Away Home Canada, happened within York University, mobilized through the Homeless Hub, and we can see the impact on youth who have experiences of homelessness. So that's just an example of the types of the relationship between knowledge mobilization and the impact of research. And I'm going to illustrate this through a little bit of theory. So I want you to keep that Stephen Gates youth homelessness in mind, and to say that generally those of us who sit in a campus space sit in different spaces than air quotes community. And as I said previously, that it could be industry, a community or nonprofit organization, could be a social service agency, a municipality. We tend to sit in different spaces. Knowledge mobilization are things we do to bring us into the shared space. That's that red arrow. And sometimes it's a shared space of knowledge transfer where I have something and I give it to you. It might be a space of knowledge translation where I have something and I adapt it into a format that is more accessible for you. That's the role of the Homeless Hub, is the knowledge translation. It might be one of knowledge exchange, where I've got something to give to you and you've got something that you can give to me, but we're not necessarily working together. It might be a shared space of co-production, where we're working together. And sometimes when we create that red arrow, that impact can occur. And I say my uncomplicated definition of knowledge mobilization is it helps make research useful to society by supporting engaged scholarship from inception to impact. So it helps make what? Research useful to whom? To society. How? Supporting engaged scholarship. That's the red arrow, engaged scholarship. And when? From inception to impact. And so this creates a logic that knowledge mobilization is how we do things. And I explained that in the slide with Stephen Gates, and impact is what we want to occur. And so we want to evaluate impact. We want to evaluate for impact, but we actually the interventions we make are knowledge mobilization activities, whether they are transfer, translation, exchange, or co-production. And this logic between how and what, well, I'll say this is a very linear and uncomplicated model. The co-produced pathway to impact has arisen out of that model. And I'm not going to go into the details, although I certainly can, about how we transition from the uncomplicated model into this, but focus on the words in the middle, that we do research and that research is disseminated and somebody takes up that research. So this is that important space where research is disseminated into academic spaces, but also into our co-production partner spaces. And somebody takes it up and they evaluate it. If it's any good, they're going to use that. They're going to implement that into their policies and practices and their services. And those are going to have an impact on the lives of end users. And all the way through it, underneath, we are engaging with interested groups. So there's a space for academics to do their thing. There's a space for co-production partners to do their thing, but this co-produce pathway to impact, because there's a middle space where we're co-producing research, we're disseminating to academic and non-academic audiences, we are facilitating the uptake of evidence in the context of its use. We can help, we can co-produce with our partners on implementation. But here's the important thing, look at that impact is coming from our co-production partner spaces, because I say to my researchers, you don't make product, industry does. And you don't develop policy, government does. And you don't deliver social services, community does. So if we want our research to be able to have an impact, then one of the ways we can do this is by supporting engaged scholarship or co-production. There's a number of benefits under each of these stages, but very importantly, along the way, there's engagement with interested groups. And I'll come back to this and illustrate this with an example. But I'm just wondering right now, because I've gone very quickly, Pierre, I'd be happy to take any questions on this model before I go into illustrating how this works with engagement with people with lived and living experiences. So I'd be more than happy for someone just to unmute right now and just ask a question if they have any.
Thank you, David. Yeah, and similar, if you prefer to just type it in the chat, we'll be happy to relay that question to David.
So I will continue, but yeah, do put things in the chat that we can come to later. And Pierre, if there's anything that's burning, you just say, "Hey, David," and we'll get a little sidebar on a question.
Sounds like a plan.
Okay, so then the thinking of engagement with interested parties, and one of the interested parties or groups, one of the interested groups would be people with lived and living experiences. This was an article, is an article from 2013. It was by Sarah Bowen and Ian Graham, a Canadian article, and a light bulb went off in my head. From engaged translation to engaged scholarship, from knowledge translation to engaged scholarship. And they said in this article that the failure to bridge the knowledge to action gap, that's the gap between what we know and what we do, the failure to bridge the knowledge to action gap is not a failure of knowledge translation, it's a failure of knowledge production. And what he means by that is, it's not a failure of knowledge translation. You can translate the heck out of your knowledge. You can send it over the fence, but if it's not what people are looking for, they're not going to take it up. So it's not a failure of knowledge translation. It's a failure of knowledge production. We're not producing research that is in demand from policy, from industry, from community, or from people with lived and living experiences. And so this really struck me that it's not about knowledge translation. It is, that's important, but it's also about engaged scholarship. How are we working with community organizations, with people in society, so we can understand needs and then doing research? And this was illustrated by the Rick Hansen Foundation. For those of you who remember the 1980s, Rick Hansen is a wheelchair athlete, spinal cord injury. In the 80s, he wheeled around the world in the Man in Motion tour, visited, I think, 44 countries, raised awareness, raised funds for spinal cord injury and research. When he came back to Canada, he set up the Rick Hansen Institute, which is still going. And he first talked to people, interested groups, and he talked to clinicians and he talked to researchers, and they said this, Rick, the most important thing you can focus on is neuroimaging and biomarkers. And Rick said, okay, thank you very much. And he went and talked to people living with spinal cord injury and their families, and they said bladder control and erectile dysfunction. So it's not that we don't need neuroimaging and biomarkers, but we also need work on erectile dysfunction and bladder control. And so it's about who is the expert in the room. And those of us on campuses are generally considered to be the experts. And part of knowledge mobilization is finding out who are the other experts in the equation. This might be the expertise of industry, of policymakers, or the expertise of lived experience. And so some of the work that I'm going to talk about appears in the ChildBright 4 levels of how ChildBright measures engagement. I'm not going to go through all these levels because that's on your website, but I'm going to talk about a priority setting with Kids Brain Health Network, which is attend a focus group, short-term or one-time, a level 3, which is contributing to the organization. And then level 4, talk about people with lived experience in grant reviews. And I'm not saying that this is something that ChildBright needs to do, but it's examples from my practice of where I've seen effective engagement with people with lived experience. So, and this is the engagement with interested groups, again, an important part for the co-produced pathway to impact. It underpins the entire pathway from research to impact. So in Kids Brain Health Network, and Dan Goldowitz and Tom, gosh, Tom, I've just forgotten your last name, blanked on it. But Tom, we're part of this, and I was the KT lead for Kids Brain Health Network for a 5-year cycle. And working with Annalise Poets, we did some deep engagement with stakeholders in stakeholder needs in neurodevelopmental conditions in Canada. We did a series of deep interviews. And it took 2 years. So this is when we do this this environmental scan and needs assessment, it does take significant resources, and it's a deep work where we in 2016 landed on 44 needs and 9 themes. And then we did an in-person stakeholder prioritization event. We identified top 10 needs. And then we went back into an online survey. We had 656 responses from frontline workers, parents, self-advocates, educators, researchers, clinicians, allied health workers, and policymakers that help prioritize the needs. And through that, we did the prioritize with the ones that got the most votes, the ones that got the fewest votes, and the ones with the most votes, we scratched out those that were not within the mandate of Kids Brain Health Network. And you can see the number one need as identified by this environmental scan was mandatory training for teachers and staff. It was that my kid is in the classroom sometimes as long as they're at home and awake at home. And so we need to have specialized training in schools. And that again comes down in the 1, 2, 3, 4, 5, 6, 7. So the one that starts with a 4.19 to more professionals in schools. And so Kids Brain Health Network was able to use this information, and it supported some research already underway through Jessica Bryan at Bloorview Kids Rehab, but they co-produced a research with early childhood educators. And this is the research that informed a program called Social ABCs. And it was funded in part by the Ministry of Child and Youth Services, and they were involved in Ontario for testing in other community settings. The dissemination was they published their peer-reviewed papers, they went to their academic conferences, but they also went to family events, to family conferences. And one thing that the KT core did was we helped to translate the Social ABCs manual into a parent manual. We've made it more accessible so that parents could implement social ABCs at home, just as the early childhood educators could do it in a classroom setting. The uptake was train the trainer model, where researchers were training early childhood educators who could then train further. The implementation settings and also at home. And then Pierre, I'm happy for you to PDF and share these slides. This link is a lovely global news story about the use of social ABCs. And it talks about a young boy named Alex, who at 30 months was nonverbal, but at 6 years old, he was chatty, he's making eye contact. And his mom says in the news piece that Alex said he loved me for the first time when he'd been taking social ABCs. And so it's a story of one child, but it's backed up by all the evidence that was developed. And this just illustrates that co-produced pathway to impact. The other piece I'm going to just talk about now a little bit, and this is, again, is not saying Child Bright does this or must do it, but how are people with lived-in living experiences engaged in the actual decision of what research gets funded? And I've seen this happen 3 different ways. One is it could happen at the same time where lived experience reviewers are at the table with the scientific reviewers. It could sometimes happen before the lived experience review could happen before the academic or science review. And sometimes it could happen after the science and academic review. So in the first one, there's some literature on this, and I've seen it myself, especially I was a part of a grant review in the UK from the National Institutes of Health Research. And there were public reviewers around the table with the academic reviewers. And it was very clear to me that the public reviewers were nice, that they were there, but their voice was secondary to the academic and scientific review voice. And I think that's one of the challenges is we've got a power differential when people are at the same table. I've seen it with one funder in arthritis where there was they were called a arthritis consumer panel. And the Arthritis Consumer Panel did a review, and before it went to scientific review, and only those applications that were created the standards or passed the standards of excellence for the consumers went to scientific review. And then it's not so much lived experience, but after the scientific review, I was involved in a review with Science Foundation Ireland, and it was an impact panel. And the impact panel only was sent applications that had passed scientific review. So all of the applications that came to the impact panel were judged as excellent by international standards of peer review. And it was the impact panel that made the final recommendations to the funder to fund. And so I really think that separating the lived experience review from the scientific review is a way of giving real meat to the lived experience review to give that review a gatekeeper, a yes, no. But it does require training. It does require compensation, not just for time, but compensation for parking, sometimes care responsibilities. You might need family childcare or elder care, and it does require additional time. So my suggestion to ChildBright, if you are using lived experience in peer review, that you think critically about how you are building capacity of lived experience reviewers to be able to meaningfully contribute to those research funding decisions. And I'm going to now stop sharing my slides, and I will welcome questions, and then we can turn it over to the panel. Thank you, Fabiana.
Thank you so much, David.
Oh, go ahead. Sorry, Pierre.
Oh, sorry. No, I was just handing it over to you, Jenny.
Yeah, thank you so much for that, David. I think that's really, it's a great overview, and I love seeing those different models. And I think everybody else did too. Lots of folks are wanting copies of the slides to share, so so we can get that with your permission. And so we'll go now into our panel, and we'll start with some introductions. So can we, Catherine and Fabiana, can you guys introduce yourselves and share, oh, here we go. We've got the text on the screen here. Share a brief explanation and update on your phase 2 research project. And we'll start with Catherine and Fabiana.
Yeah. Fabiana, do you want to start, or I could start? So hi, I'm Catherine. Thank you very much for the invitation. I'm here today with Fabiana to represent the Parent Voices project team. So just an overview of our project. So the goal with this project is to implement new patient-reported outcome measures into standard clinical care and research data for children born very preterm. So we're working with the Canadian Neonatal Follow-up Network to implement the new measures in the neonatal follow-up clinics across Canada. And the reason we want to implement these measures is to emphasize the parent voice. And that's why our project is named Parent Voices. So that the parents can share what they consider important and meaningful to them. So we want to shift the focus from using, mostly medical terms, diagnosis, to really outcomes that are meaningful to parents. So for example, participation, function, quality of life. So as you can see, the aim of our project is very patient-oriented. So it only makes sense for us to adopt a patient-oriented approach and to work in partnerships with partners with lived or living experience. And just to give you a quick update on our project, so before we can implement the new measures, we need to decide which measures to use and how. So we want to make this decision based on the perspectives of those who will be using these measures. So in our case, it's the parents or caregivers and the healthcare professionals. In the phase 1 project, which was the Parent EPIC project, 3 different measures were predetermined. And now in phase 2, we are conducting surveys to gather the opinions of parents or caregivers and the healthcare professionals on those measures to decide which one we will use. So we're aiming for 2 of them. We're also preparing for the next step, which will be to conduct interviews to identify the barriers and facilitators to implementing those measures, and to begin developing our implementation strategies. So we're aiming to start implementing them in 2025. So I can let Fabiana introduce herself.
Yes, hi. Thank you for having me today. I'm Fabiana Bacchini. I'm a mother of surviving twin born at 26 weeks gestation. He has cerebral palsy. I'm also with the Canadian Premature Babies Foundation, and we've been partnering with this project from the beginning. Thank you.
Thank you for that. Iram and Jillian, would you like to explain your project
Sure.
yourselves?
Yes. Hello, everyone. Thanks for joining us today. I'm Ibrahim, a PhD candidate in rehabilitation science at McGill, and also an occupational therapist by training. And I have been a graduate research trainee within the Jouer app project since 2021. And today, Jillian and I represent the Jouer app project. And about the Jouer app focuses on participation of children with disabilities in leisure activities. And we know that participation in sports and other leisure activities is an important part of childhood development. However, it is hard to find the right information about adaptive and inclusive leisure activities for children with disabilities, their families, and clinicians. So Jouer is a free mobile and web-based app and is a response to the barrier of lack of information about adaptive and inclusive leisure activity, where it provides families, clinicians, and educators with information about leisure activities available in their communities all across Canada. And in this project, we are constantly seeking ways to optimize the use of this technology, to increase its use for more children and families, and to use it as a tool to inform policy and community changes. And in terms of the current status of the project, we are currently working closely with the Jouer users and also the Jouer research team to develop new game-like features for the app. And these features aim to make the app more engaging for families and children, while also making sure that it's inclusive for children with disabilities. And our goal is to encourage more participation in leisure activities for children with disabilities. Also, as a part of our focus on implementation science in phase 2, we will use different implementation strategies, such as collaborating with knowledge brokers to raise awareness of adaptive and inclusive leisure activities across Canada, as well as scaling and spreading the use of the Jouer app. Now I would pass it to Jillian.
Hi, I'm Jillian. As Abraham said, I also work with the Jouer project. I'm part of the advisory committee for people with lived experience. I've also been a research assistant for the project as well. So I've kind of held different roles in giving my lived experience and kind of what I would like to see in an app like this. I'm above the age range for what Jouer is targeting, but from my own lived experience, I know that an app like that would have helped me access leisure and different activities. So yeah, that's a bit about me.
Thanks so much, both of you. And now we'll hear from Angie and Brenda.
Thank you. Sorry, I'm losing my voice a bit. My name's Angie Lim. I'm a postdoctoral fellow with Childbright. I'm a nurse by background. I'm just going to share my screen quickly. I can't start. Let me. There you go. I'm a nurse by background, and I'm based out of Toronto, and I work at Sick Kids Hospital. I'm also a clinical nurse specialist in professional practice with a background in transplantation. I am involved in the CSENT and ADAPT studies. So CSENT is the Coach Coordinated Enhanced Neonatal Transition Project that took place over the last few years. And ADAPT is the second phase of that project, and that's the assessing and developing adapted navigation to support parents during the neonatal transition. So in our phase 2 of our study right now, we're working with participants that participated in phase 1. So parents of high-risk infants who transitioned out of the NICU to home were either randomized to an intervention where they had a nurse navigator along with some mindfulness training to support them in that transition, moving out of that really, protected, supported NICU setting into the home setting, or they got standard care. So in our phase 2, we're looking at having focus groups and really engaging with those participants in a kind of deeper level to understand what those barriers and enablers were of that nurse navigator role. So the participants themselves and also the nurse navigators. We're working with a parent advisory group as well that has people with lived experience who have children who had previously been in the NICU and have experienced that transition to home. And working with them, we're going to also move into the second phase of phase 2, where we'll create an implementation strategy and like a blueprint of what that adapted navigator role can look like. And there is a planned phase 3 of the study that will come in future, and that's actually testing out that revised navigator role. And I have Brenda here with me, who is part of our project, and I'll just quickly show I can get my slides to work, what our study governance looks like. So we have, we're really lucky to have Brenda as part of our team, and she's a co-PI as well on our project, as well as the lead for our parent advisory group. And we have a lot of co-investigators, but our parent advisory group really adds a lot of richness to our data and is going to be really supportive in identifying and making sense of all of the kind of data that we get from those participants. Kind of just a timeline of what this looks like. We had hoped that we would have started our recruitment already, but some delays with ethics that we just got at the end of last week. We're just starting our recruitment process now. So we're hoping that we'll move forward into the remainder of our data collection over the next few months and hopefully get all of this stuff wrapped up by the kind of middle to end of next year. I'll turn it over to Brenda.
Hello, everyone. Thank you for inviting me to be on this panel today. My name is Brenda Blaze, and I am in London, Ontario. I am a partner with lived experience, and I am, as Angie mentioned, a co-PI of the ADAPT study. I'm also on a family advisory for another study, also at Sick Kids. My involvement with these studies stems from my experience as a lifelong caregiver, navigating various health and disability systems while advocating for individuals with multiple physical and intellectual disabilities, along with medical complexities. And my motivation and inspiration to be involved with this work comes from caring for my daughter, who was a high-risk infant, and as a result faced multiple disabilities and medical complexities her whole life. And she passed away 2 years ago at the age of 29.
Thank you so much for all of your introductions. And just as a follow-up question to this, and especially wanting to hear from the folks with lived experience on the projects, what have been the most rewarding aspects of your roles, and what impacts have you seen from your contributions? Feel free, anyone, to jump in.
I can start. ADAPT is in its very early stages, as Angie mentioned. Ethics just went through last week, so I can't quite comment yet on the impact of my contributions. But I can say that I find it very gratifying to know that my insights and my perspectives drawn from my lived experiences are appreciated in this realm, and that they're relevant and that they can potentially enhance the outcomes, not just for those impacted by the research results, those with the lived experience, but also for researchers themselves.
After, for me, I've been involved with parents' voices from the beginning, so I can talk more about that phase than to say it's because it's brand new for us, for me. But I think the most rewarding thing for me is to work side by side with researchers and clinicians that are very committed to creating the change and improving the lives of our babies who are born preterm. And I feel that we have a shared vision, and for me, that is very fulfilling. And one of the contributions that I think is most valued for me is when I review scripts, grant proposals, surveys, and any other materials that the team share with the parent partners. And we see those changes and our insights incorporated into the final versions. I think that is very meaningful, that we really see that we have a role in the team. And I think that is very important for us as you're coming to these research projects.
Mhm.
I can jump in here as well. I think for me, there's a saying, nothing about us without us, and it kind of follows through here, being that seeing as patients with lived experience are ultimately the ones that are directly affected by research, and that they should have be having the say. So it means a lot to me to be able to be part of it, and also just be part of the collaborative process, not just at the end to make it look like there was involvement, but throughout the stages is something that's really important to me.
I can just add to that as well. Just, I know I'm not a parent partner, but I had a younger sister who was a cardiac patient from birth, and was at Sick Kids until she turned 18, and just a couple of weeks after she turned 18 developed like a bloodstream infection and was in hospital in adult care for some time, which really impacted my perception of like care and the way care should be delivered and that transition process. And it really drove my desire to nursing, and really led me to pediatrics. And being involved with parents in this way, on the research side, is really rewarding to me, and it really is meaningful because I've been on the other side of it, and I understand the impacts and how much having your voice heard is important. And just coming from nursing, that's like really like the basis of nursing is that therapeutic communication and interacting with people. So it's so meaningful for me every time I get to engage with any of the people with lived experience or the parent partners. It's just so rewarding and really re-emphasizes that like importance of hearing people's voices and making sure that they're represented in the work that we do.
Thanks for that.
Jenny, it's
Yeah.
David. I wonder if I could amplify something Jillian just said, because it's so important. She talked about being involved from the beginning. And I do really, we might be preaching to the converted in this webinar, but it's so important that the lived experience voice is engaged authentically and not in a tokenistic fashion. And being engaged from the beginning, it means that you're, as I said in my presentation, you're setting up the research in a way that is meaningful, so is meaningful at the back end. And so I think, to echo what Jillian said, you can really only do that if the engagement happens at the beginning and then throughout. So thanks for that, Jillian.
Yeah, and just to add to all of those thoughts, one of my children has a like super rare condition, autoimmune condition, so she's seen it at Sick Kids, and so because it's super rare, there's lots of research projects that we're part of, and the great care that she gets there, but a lot of the research, like she kind of complains because she's just like, well, it's basically kind of some questions for her about her quality of life and how it's affecting her. And the ways that it affects her, like they don't have the questions for, right? Like, so it'll, she's like, well, they have a question about the blood work, but I don't have problems with the needles. What I don't like is missing school to go to the appointments, or what I don't like is this, and there's not sort of these questions that are about the things that she cares about. And I was, kind of talking to her about my work too, and being like, you know, it would be great to understand ahead of time and have, you know, that input into what the actual questions are that are being asked, right? And that's not there. So it's like we're not measuring the things, like the Rick Hansen example as well, right? Like what are the things that are actually important?
Yeah.
So our next question here is you know, around and for the PWLEs here, what steps have the team taken to ensure that you're fully engaged in the phase 2 project work? And from your perspective, what aspects of being engaged with the project have worked well, or if there's improvements you would suggest? Or maybe if it's sort of early stages, you can kind of talk about what's worked well for you in the past or what your kind of hopes are around it. And we'll start with Jillian.
Yeah. So the team has been really good at um basically accepting feedback in whatever format works, which I think is really important. There's been times where I haven't been able to attend meetings to get my opinions on different things, and they've been willing to either schedule a different time for me or just do it back and forth through email, and that's something I really appreciate because oftentimes, like, I do have things to add, but with school and work and all the other things I'm involved in, it's not always feasible, and I think that's true for anyone on research projects as well that aren't part of their daily life. It's important to kind of have that flexibility um to get the involvement.
For sure, being able to accommodate different needs and you know, enable your contributions is so important. Brenda, did you want to go?
Sure. So as we already know, the ADAPT is just getting started, but so far communications by email and Zoom meetings have been quite good, and she's been really good about keeping us updated, especially with all the delays with the ethics. But what I would say that as far as improvements go, I'm quite fortunate that my career prior to leaving it to take care of my daughter was working for medical doctors and researchers. So I provided a lot of clerical support in grant applications and typing manuscripts and all of those steps along the process. So I'm really fortunate that I have that background knowledge, and that's something that the ADAPT team doesn't need to take a lot of time with me to teach me on. However, when I listen to the meetings and sit in on other meetings, there was a child break meeting on Monday too, a lot of acronyms are used, and it dawned on me on Monday, I'm quite privileged to know what all of that means, because if I didn't have that background, I would be probably feeling pretty left in the dark. So an improvement I could suggest is to have some resources available for new partners with lived experience who don't have any background in research, to understand what the acronyms are, what the process is, you know, why is ethics taking so long? What does that mean? Those kind of resources that they can easily reference, whether it's a video or an infographic, and certainly time with researchers in the project to enhance their knowledge and train them. And perhaps there could be some materials that Child Bright could create for that purpose as well, to help the researchers train the PWLEs.
Yeah, absolutely. And I do believe we have some work underway around that training piece. And I think that's so common, not because I come from sort of involving patients and families in the healthcare sector and more in quality improvement for hospitals or health system stuff. And it's similarly, it's lots of kind of professionals who are sort of thrown into leading a patient and family advisors committee or leading different projects, or okay, go, you know, have some patients on your committee, and they're not really prepared for that. They're used to having professionals and clinicians on their teams, and it can be quite alienating, and it's already kind of alienating or intimidating to maybe join those groups as a you know, just kind of patient or caregiver advisor. It's really important. And research is even more kind of intense and layered, and yeah.
I think that knowledge for those with lived experience would also be very empowering and help them feel more assured in their roles.
Fabiana, did you want to share?
Well, at first I agree with everything that Brenda said, but I'm going to add just a few pieces. But first, one made your first question made very clear that our collaboration was valued, was inviting all of us back to participate in phase 2, because all the parents engaged in phase 1, continue in phase 2. So I think really show that, yeah, they value our contribution. So that's why we are here. And one doctor actually said at one meeting, I don't know how I did research before without partners with lived or living experience. For me, that was really acknowledgement that we are changing slowly, but we are changing what is happening in research in Canada. And for me, that was very meaningful, because we always discuss, like, we are pretty much the first generation engaging in research that way. So we have a lot of work to do, and for future generations coming after us on how to engage in a good way. So what worked really well for our team is I feel there is organization and the structure. We have pre-scheduled meetings planned for many months ahead. So it really helps us to organize our schedules. We don't have a flexible schedule for the meetings, but you know, every one Monday or every other Monday we have at 4 o'clock, so we can get organized. But if you cannot attend the meetings, we are able still to provide feedback and review documents online. I think we use Google Docs or some of those Google things to do in real time with engaging with other people. And I think that is very, very important for us, because you can do in our own time. Because a lot of times we're going to do this kind of work when it's after kids go to bed or early in the morning, because a lot of parents do have full-time jobs. We also have been fully engaged in many conferences with this project, and we've been presenting across Canada. Some parents have presented posters independently in conferences and be involved in many publications. And I think that is very meaningful to all of us. As an improvement, I would love to have an annual in-person meeting with the team, because I feel that really strengthens relationships with the team, especially for newer parents who might not have a lot of experience with researchers or doesn't know the whole team, and see what everybody's doing across Canada. I think is very important. And I know it's a challenge because we're a big country. But I feel that it could really deepen the collaboration with the parents and keep us engaged for much longer time. And one thing that I find very important in every project that we participate is to have one person that is our point of contact. And I think this is so important, especially coming out of a meeting. We might need a debrief session, because many of us are coming from a place of trauma. We are reliving our experience by sharing stories or providing feedback for research and things that are coming up, but also someone who can share our concerns and maybe discuss new ideas that we didn't maybe share during a meeting or didn't come up during meetings. And I think those are places for improvement. And I would love to have more training with David, because your session was so good. I learned so much in 20 minutes. I would love more of that to be more engaged in this phase 2.
Thank you, Fabiana. Childbright knows where to find me.
And so we have Jillian and David. You both raised your hands there. So did you want to go ahead, Jillian, and then David?
Sure. I just wanted to add that compensation is super important, and it's another way that kind of enforces the value, or at least for me, just because oftentimes the engagement is a lot of more work than it might seem. And like I said, we're doing a bunch of other things as well as this. This isn't usually um our main job. So just having that compensation as recognition of this work is valued, I think is really important as well.
Absolutely. And I have a follow-up question around that, but David, you go ahead.
Can I do a bit of a 90-degree turn? I think we've got enough time. A couple of times the panelists have mentioned we're waiting for ethics approval. And I'm wondering if engagement with lived experience is that driving ethics delay? And if so, are our research ethics boards set up to really review authentically engaged scholarship? That could be a wrench in the otherwise normal works. Let me give you an example. It's not lived experience, but it is lived experience. Indigenous scholarship really challenges colonial approaches to research ethics. And at York University, we've created last year a separate Indigenous research ethics board that gets the job done, but is entirely differently structured. It is chaired by an Indigenous scholar, but has elders, it has youth, it is all about the community approval. And so we had to do that, recognizing that Indigenous scholarship was creating real challenges for traditional research ethics boards, but we still need to do the work of research ethics. So I'm wondering if, especially the institutionally based researchers on the call, have any opinions about ethics.
Well, maybe I can jump in. So I know that in our case, it's going back to meaningful engagement. So listening to the feedback, because we had some feedback from the parents and the partners in our team, we made some changes to the methodology. And then we had to make an amendment for ethics. So yeah, it takes more time. But it's all about, improving the research process. So listening to the feedback that is given. And so, yeah, you have to be ready to make some changes, and it's going to take more time, but it's worth it in the end. Otherwise it's not worth, asking people feedback if you're not willing to listen to it.
And I think, in terms of Indigenous communities, that, one of the kind of values that I really admire around that they talk about a lot is reciprocity, right? And reciprocity is and I really like that word when we talk about engagement, like that it has to be reciprocal, because I've been in too many kind of tables where it's not reciprocal. We're kind of asking people, it's tokenistic, or what's kind of in it for everybody, but not just in it, like that seems so sort of capitalistic, right? Like but more like, how are we sharing this knowledge? How are we, sorry, of course, now the dog is barking, so I'll stop. But yeah, reciprocity, that's what I think in terms of creating the weebies too, and smoothing that.
And Jenny, I'll just say that on the social sciences side, a word that is often that I've been hearing used in the last couple of years is to avoid extractive research processes, where you're extracting data and opinions from people with lived experiences and not returning anything. So setting up to avoid extractive research processes.
And you can't necessarily commit to, and it's been, when I think about my career too, when I'm asking people questions about their experiences around, to look at maybe a new health technology and putting something forward to the government about funding that technology. Like, you can't guarantee that the government is going to agree to fund the technology or the treatment or the drug or whatever, but you can say that you're making a genuine commitment to trying to move that forward, right? And then that's also kind of blurs the line around advocacy and you know what we're kind of doing. But I think that sort of commitment to moving things forward and offering things back is so important. Oh, does anyone else want to add? There's a few things happening in the chat here.
Jenny Celia has her.
Oh, Celia, go ahead.
Just a question to add on to the ethics discussion. And in some institutions, I've found that there's been some questions or challenges about engaging people with lived experience in the project before, because they're involved in the planning, and some questions about whether we need approvals to be able to help the planning before the project. In some cases, it's more just making sure that you're doing the engagement appropriately and having some support for that. But are there any other models that you've seen to make sure that the engagement is appropriate to be able to involve people before the ethics goes in? Does that make sense?
I can think of something to address that, Celia. It's yeah, I mean, very in planning research, as long as you're not doing research, the planning of research should not be subject to research ethics. So because you're not actually doing research, unless you are collecting data to inform the planning, then that might be a bit of an area to look at. But there's in the chat something about we need a little bit of money. Needs to be a grant for early patient engagement. I think that's what PE stands for. So people can be involved in the planning. SSHRC does this. They have a sequence of research grants where you can get what's called a SSHRC engagement. I'm going to say PEG, Public Engagement Grant. And so it's about $25,000 where you actually do your engagement, you bring people together. It's to fund the planning of a more subsequent partner engagement grant. That's what it's called, to inform a subsequent application. And then after your public engagement grant or your partnership engagement grant, you can apply for a partnership development grant. And that's about $200,000 over a couple of years to allow you to bring the partners together. And this would include people with lived and living experiences, and then set you up to do your large partnership grant, which is about 2.5 million over 7 years. So it's kind of a graduated 25,000, 200,000, 2 million way of funding research, especially the partner engage grant. It's not research, so it would not be subject to research ethics. But that's in a SSHRC world. I don't know. I'm less familiar with the CIHR world. But I do know actually some of the institutes in CIHR, not CIHR itself, but the institutes, some of them do have meeting planning and dissemination grants, MPD, and those can be used to bring groups together.
Yeah, there's lots of opportunities that way. Where I found some challenges is when we're trying to find people with lived experience, and whether we need some institutions require some approvals to be able to recruit for people, particularly from a specific clinic within a hospital. So some of that kind of process is to be able to find the right people to be engaged in the project design to then submit to ethics. So there's just another level of approval that I've been finding in some institutions.
Okay, that's news to me, which I think is good if we are keeping our minds to protecting vulnerable people, but does it create an extra layer of bureaucracy?
Mm-hmm.
Exactly.
Angie, you have your hand up?
Yeah, my comment/question is back to the like KM piece and involving our PWLEs in engagement after the fact of like how can we support, for example, if we were to present our findings at a conference next year, how could we support Brenda to travel to support that? And that's one of the things that I think is kind of coming to light in terms of compensation. So we do try to compensate for time, and recognizing coming to meetings takes away from like like other opportunities for paid employment. But when we're looking at opportunities to have further engagement at conferences or participating in other opportunities, funding is a limitation. And I experience that myself as being just a postdoc fellow. I also have very limited funding, but if looking at our parent partners, they're really limited in what options are available to them. So I don't know if anybody has any ideas or thoughts about that.
Corinne, before I continue, want to say something?
Thank you, Angie. I did want to mention that we do have line items on our compensation guidelines that would support conference attendance and involvement. So I would be happy to follow up with you so we can discuss further, so you can support Brenda.
Thank you.
Oh, and Brenda, did you want to go ahead? Oh, sorry, Anna, you were first there if you want to go.
No problem. No, I just wanted to mention that in our project, we have a fund set aside for patient partners up to a certain amount, depending on their involvement and depending if they're presenting at conferences and stuff. So this is, we have a patient advisory committee, and for each member of the patient advisory committee, this fund is set aside. It's in the budget. But there is some travel awards sometimes, and so it doesn't necessarily cover, depending on where you're going, it doesn't necessarily cover all the costs. So there has to be a bit more support for really allowing people with lived experience to participate fully in the knowledge mobilization, in my opinion.
Absolutely. And also in terms of increasing diversity of participants too, and how there's lots of folks that might not be able to attend these, activities during the day, or, with different work and precarious work and things like that. And Brenda, you can go ahead. And I just wanted to say that we were going to kind of lead into a sort of Q&A right now after this. So, Brenda, if you want to go ahead, and then if folks have questions, you can type them in the chat, or you can just raise your hand, and feel free to ask any kind of questions of any of our panelists or David.
Thank you, Jenny. Just to add to the compensation piece, in my review of the guidelines, they don't really reflect the growing responsibilities that are being asked of the PWLEs, as in co-investigators and co-principal investigators. So I'd like to see the guidelines reflect that additional input and responsibility. And I'd also like to see a system where compensation discussions are not on the onus of the person with lived experience, but more so brought up as part of the conversation of including them. Because there is, as David Phipps had mentioned before, there's power differentials here, and that can be really a very intimidating topic for partners to address. So those are my comments on the compensation piece, and I agree with everybody else.
Thanks for that, Brenda. And yeah, Corinne's having some comments in the chat here, and I do think it's an ongoing issue for organizations, and it's really been even a pretty short time where we've actually even been offering compensation and honorariums, and I've been at several organizations where the sort of bureaucratic or institutional barriers to doing that, or finding different ways to compensate, like folks that would prefer like a food gift cards, or different things like that, instead of having a check deposited, or whatever it might be. So trying to adapt to meet the needs of folks that we're working with is so important, and it is like long overdue and still not kind of adequate or up to where it should be. And absolutely. Anyone else have comments around that, or just general questions? And we can, I think, yeah, we can just move on, and if people have questions, just put them in the chat or raise your hand. That's totally fine. So when it comes to knowledge mobilization, what does meaningful engagement with people with lived experience look like in practice? So what are the strategies that are being used to sustain engagement throughout the process? And can start with Angie or Brenda.
Sure. So as we've mentioned, our project is very early on in our stages, but some of the strategies that I've tried to incorporate are having meetings and sending updates whenever I have information, and even just a couple of updates that say there's been no changes. We're still kind of waiting. Trying to accommodate as many people's schedule as possible when we do have meetings. So we're using doodle polls, trying to schedule around, and then recording the meetings with everybody's permission so that anybody who wasn't able to attend could listen in. And then just sharing documents and resources that we are hoping to get feedback on, and incorporating those changes, as Fabiana mentioned, is really important so that it reflects everybody's perspective. I mean, I have ideas of the things that I think are meaningful, whether those land in the way that I hope they do. I'm not always sure, but I think that we are making efforts to engage our parent partners, but I'm really interested to hear what others think about it as well.
Catherine, Fabiana?
Yeah, so if same thing, I'm gonna jump straight to the strategies. I think one thing that has really helped me is the fact that there was a knowledge mobilization and then patient engagement box in the proposal. So going back to the comments in the chat earlier about, you know, engaging partners from the start, I think that because this aspect was included in the proposal, so when the study was designed, and that a plan was made for how and when to engage partners throughout the research process, that was very helpful. Because, you know, when the project starts and there's so much to, you know, so much to do, so much to learn, so many problems to solve, that you don't always have time to think about all the little details. So going back to the proposal and seeing what the outline was, what the plan was, and then you can always make some adjustments, but having this on paper from the start was very very helpful for me, at least, to guide the different steps.
Thank you. Well, and from my side, from as a parent on this project, and also on the CSENT project, I was involved from the very beginning, from the conception of CSENT. So for me now, being part of knowledge mobilization, I already know what's happening. I've been there from the beginning. I know where we are trying to go and what we're trying to accomplish. I think that is, it gave me a sense of ownership of the project, raised my interest in the project. And obviously now I'm very excited that we're going to phase 2 for knowledge mobilization, because I really feel that I can advocate for the implementation. But one thing that for me is very important with parent voices is that we not only collaborate with the individual partners, but we also collaborate with community. And I love that David mentioned about community organizations. I am with the Canadian Premature Babies Foundation. We are a parent-led organization, and we have deeply invested in these projects. Any project is concerning preterm babies' outcomes, we are invested. So we want to work with this project. And we've been, over the last few years, created materials, several materials, from infographics, videos, blogs, and you've been together raising awareness through webinars and joint presentation at conferences. So we do create materials for the neonatal follow-up clinics, and they share those materials with the families. So for us, this is very, very meaningful and important for long-term sustainability. Because I don't feel I mean, in every research project that I participate, it's great to have the publications, but it's what do we do with the publication? You take that evidence and you advocate together to really have a meaningful and real change in neonatal follow-up clinics across Canada. And I think that is seeing that commitment with the team, including us, is how we're going to sustain this long-term process and engagement with parents like me.
Thanks for that. And on that note, I think that just before we go on to Ibrahim and Jillian, I kind of wanted to ask you, David, about what folks are talking about now. I'm just connecting it back to what you shared around the homelessness project, and I'm wondering, was there any kind of feedback towards the end of on those kind of outcomes back to the researcher around impact, like when kind of evaluating engagement and the activities, just curious about what perhaps people's lived experience were sharing about that, about seeing the sort of impact of their contributions in the knowledge mobilization.
Yeah, in that project, it's people with lived experience are so embedded that there wasn't a sort of go away, do research, evaluate the impact, and bring it back to lived experience, people with lived experience, because they were part of all of that as they went along. And in addition, then the evidence published in academic papers for sure, but then the Homeless Hub is a place where it's translated into accessible formats. So again, making accessible to people with lived experience that were not necessarily involved in the project. But then I think one of the key ways that that project helped to bring the evidence back to people with lived experiences through the community partner Away Home Canada, and being community-led, not led by academics, and actually not having any academics affiliated. It was they were the Homeless Hub and Away Home Canada were kind of the mobilizing agents of that program. And so very much people with lived experience were engaged all the way through, but then there was these dedicated efforts to get the evidence back out. And I will also say that very targeted engagement with policymakers as well. And that was work that Away Home Canada did, not work that Stephen Gates, the professor, did.
Thanks for that. And Ibrahim and Jillian, did you want to share?
Sure. I believe one of the strategies that help us, the JUA team, to take one step forward to make the engagement of the PWLEs more meaningful in the JUA project was involving them in the decision-making process and about different aspects of the research process, not only the beginning, throughout the research process. And David, I guess, highlighted the importance of the co-production or co-design throughout the research process. And as I earlier mentioned, we are currently developing a new version of the JUA mobile app. And for example, we constantly share our progress regarding the developing a new version of the app with PWLEs, and they give feedback about the app prototypes at different stages of the JUA project, which help us to refine the prototypes. And I believe we can also be creative in how we collaborate with PWLEs. For example, we did an interactive activity on the Miro board, which is an online collaborative platform designed for real-time collaboration and brainstorming. And by doing this activity, we could collectively decide which new app features or prototypes should be tested first with the users for the next step of the research project. Or another example was doing another activity on the Miro to brainstorm which implementation strategy would work best to scale up the use of the JUA app for different target groups, such as clinicians and municipalities. So at the end of this activity, we came up with a list of different implementation strategy for different target groups. So I guess that helped us to make sure they are actively involved in the decision-making process. And following the first strategy, I believe it is important to be flexible with the engagement strategy that we are using in a project. I believe Jillian mentioned about the flexibility and I guess we need to always come up with some alternative engagement strategy because some PWLEs might not able to attend the meetings or do this interactive activity together. So we always come up with alternative strategies such as sending the documents or sending a specific questions or requests for feedback by email to them. So I believe these strategy help us to actively engage PWLEs in the JUE project.
One thing I guess I would add to that is in some projects I've done, it's almost seemed like the PWLEs were supplemental and not required as part of the project, and I think that's something that when you're meaningfully incorporated, it means that the project can't go on without your contribution. And I think that's something really important. Like, we want to make sure that it's something that's meaningful, and the product wouldn't be the same without it. And that's something that I think JUE has done really well, because every time I've given feedback, like, I've seen it be implemented, which is really nice.
Yeah, I think that's so important to feel like you're there for a reason and that your contributions are valued and having an impact, and you can really see the direct results of that. Because the alternative is sort of sitting there and wondering, like, what am I doing here, or what am I actually needed for? I mean, for the researchers on the call, do you feel like that you have known sort of all the way through what you were kind of looking for from your PWLEs, or that you knew how they were going to contribute, or what they could contribute, or have you sort of like left that open and wanted it to be sort of more guided by them?
I can start. I think it's been a bit of both. I've kind of had some ideas of things that we would benefit from having that insight on. For example, looking at our focus group guides and our infographics and things like that, and our communications, like those seem pretty straightforward, but I also want like that organic piece as well, so that as things are developing, have them decide on things that they might find as being meaningful, or maybe people have different strengths. Like Brenda mentioned, she's got, a lot of experience in like funding and doing some of these applications. So she might take on a stronger role in those aspects. So trying to identify, like really trying to take a strengths approach to it, and identifying areas that people would be more inclined to be involved with, or have more engagement in certain areas, but also wanting to have all of those opportunities open to everybody at the same time.
Absolutely. Anyone else?
Jenny, I wonder if you could unshare the slide and we can see if there's others on the webinar who might want to join in.
Yeah, feel free to type, just, raise your hand. Oh, we got Keiko there.
Sorry, I got in a bit late. I was in another presentation, but I just want to add to what Ibrahim and Jillian said, and to answer your question, Jenny. I think for JUE, one for us at least, I think what has been key in defining, like, it's been organic in a way that, because the partners and so all the partners have been involved for so long now, it's been like, I don't know, numerous grant applications and projects from different fundings and networks and across each of the funding. So now for Child Bright, it's solidified, I guess, the patient-oriented, the PWL experience to it, but it's, I think when you build a long-term, so I think that's the answer to that I wanted to give for your question, was like when you build those partnerships over time, it gets to a point, and I think we're fortunate to have reached this point with Joy, that people really provide ideas all the time. It's a dynamic interchange. So some of, and I would say less of the research questions these days, or just questions of ideas for the project, way less come from the researchers and way more comes from the partners. And people will suggest, why don't we do that? Why don't we try that? Or I saw that, can we do that? And on the ongoing meetings and different encounters in different ways, we end up integrating those into the life of the project. So so there are less and less demands that come from us, like from the research side, to say, can you do that? And more from the other side, so the partners coming in, approaching us and say, can you do that? And we try to respond. So we are becoming the partners. And I think that's a point that it takes a few years to build. But I'm always happy when people say like, oh, we are the token researcher, quote unquote, so that we are the researcher that people can go to when they want to do things. And I think that's a great place to be, as opposed to the contrary, right, where we are going to people with requests. So
yeah, and I think that really speaks to just the importance of the building those relationships, and that it's not just like an overnight thing that you're just gonna have, like any collaboration, that you need to build that trust and connection between everyone. Feel free to jump in with any last comments, folks. I was gonna ask David if you wanted to just kind of sum things up or add anything from your experience to the conversation before we close in a couple minutes.
Any last questions? Otherwise, I'm happy to wrap up. Okay, so thank you. This has been really, really a wonderful experience. I mean, to come back to some of my Kids Brain Health Network roots, some of those are showing. So thanks very much, Pierre, for this. Tom, who I don't think is on the call, but Dan certainly is on the call. I think Child Bright's doing an excellent job with engagement with people with lived and living experiences in research. The projects that we've seen today are just testament to that work. Things that we've heard that we all agree on: engage early, engage throughout. Don't just wait for transfer at the end. We've heard about building capacity. I think that's really, really important, and how actually that the capacity building and the engagement can get funded. Because one other thing to talk about, to mention, was that some, especially parents, they have jobs, and so they can't necessarily make a Zoom call at 1 PM. So, find times where the parents are available to be able to do this work. It's really important, and we've seen this today, that patient and public engagement really redefines who the experts are. And it's not that the academic and the clinical expertise isn't relevant. It absolutely is, but it needs to be equated. It's on the same different but still important type of expertise that comes with the lived and living experience. And I'll just close with one thing that we haven't talked about is oftentimes a project will have a lived experience or a parent advisory board, which is great, but it's still advisory. There's no power given to that advice. And so finding ways to give power, to balance the power between those who traditionally have it and those who don't. And an example that I have seen in the doesn't exist anymore, but the Network of Centers of Excellence, well, they're knowledge mobilization programs, but even making the shift, which was the youth homelessness one. We put the CEO of Away Home Canada, when we were supporting that application, there's a space on the forums for the scientific director and the co-scientific director. And I phoned up the NCE and I said, we want to have a scientific director, and the CEO of Away Home Canada, we want to have as the implementation director. How do we do that? There's nowhere on the forums to put this. And so we scratched out scientific director or co-director and put in implementation director. Both of those people had to report to the board of directors, right? So all the decisions for funding and for programming were jointly led by an academic and a non-academic. And so it's not an advisory board. It's actually engaging at the same level as we have scientific leadership. So we can, if you remind me, Jenny, I can share around Arnstein's Ladder of Engagement. Shelley Arnstein published this in 1969, way ago. I was still alive, but it was the ladder of engagement from tokenistic engagement all the way up to public or community led. And I think community led is great, and especially in some paradigms like Indigenous scholarship, we absolutely must be community led. But 2 rungs down from community led is partnership. And I think that's a really important space where we've moved above the tokenistic engagement of non-academics in research, and we're creating a true partnership where we've got power invested in both the academic and the non-academic voices. So I just leave that as some thoughts for Child Bright, and just say thank you very much for this opportunity.
Yeah, thank you so much for joining us, and thanks to all our panelists for coming. And I just want to plug our engagement program. So Corinne has spoken a few times, and I'm the director of engagement here at Child Bright. So if you're looking for resources or information, please reach out to us. And yeah, thank you to everyone. Pierre, I'll just hand it back over to you as we close.
Thank you, Jenny. Yeah, so I have a quick few comments to conclude. So again, thank you all for all panelists joining us today, as well as Jenny and David, who helped facilitate the discussion. Wonderful stories and experiences shared. So I'm hoping we all were able to take something away from it. And in the last minute or so of the session, I just want to mention that we do have the next symposium entry happening next week. And I can find my chat box, so I'll add the registration link. So if you have not signed up yet, feel free to do so, or share it within your respective groups. And if it's something of interest to them, the discussion will be focusing specifically on the transition into Child Bright's phase 2 efforts and the focus on implementation science. In the chat as well, I've included an evaluation survey just to invite some feedback on today's session and sort of the general structure of these symposia sessions. Welcoming your feedback, so it can certainly help form the next iteration of a future symposium that we will plan. So that said, we will follow up with an email again in the next day or so, providing you the link to this recording as well as some of the materials that were discussed. So until then, enjoy the rest of your day, and I hope to see you all at the next session on Friday the 18th. Take care. Bye.